Are there like risks associated with giving or receiving oral sex?
Yes, for sure. You can get herpes with just one occasion.
How can a dentist tell?
Your mouth and then down there, things are connected. Fun fact as well, the tissues in the vagina are the same tissues that are in your mouth.
Spit versus swallow.
It's the same thing in terms of oral health.
My name is Karishma. I'm a sexuality educator, and this is a series where we unlearn and relearn all those common myths, misconceptions, and questions which really should have been part of the talk.
Hopefully we got it.
Welcome to Talk You Never Got.
Hello everyone, my name is Karishma and welcome to Talk You Never Got. Today we're speaking with Dr. Shyrie Patel, who is a dear friend and classmate.
Hi everyone.
And we're going to talk about something no one really talks about, which is dental health and how that affects sexual health. So,
Big topic.
Big topic. I'm so excited to dive in, and there's definitely stuff that I do not know the answers to. I'm really excited to ask you all of this. But before we start, if sex were a food, what would it be and why?
So a little bit of a different answer. I would say it's like a tasting menu. Each dish is curated to your own taste buds, mix and match style.
Is there a cuisine or?
Personally, I would say Indian cuisine because it's spicy.
Slightly biased opinion.
Slightly biased.
I love that. Okay, awesome. Give me a 1-minute description about yourself.
For sure. So like I said, I'm Dr. Shyrie Patel. I'm a dentist, practicing dentist. Currently a Master's of Public Health student at Harvard, where I met lovely Karishma over here. Live in Boston and excited to talk, excited to be here, talking about all the oral health things.
Yay, okay, awesome. And tell me, like, what is a time in your life that you've been like, wait, I wish that was covered in the talk you never got?
I didn't get the talk, like sit down talk, but things here and there. So things
Makes
here and there.
sense.
And there's definitely was some missing information. One thing that was new to me, and this I learned honestly after being like during dental school, was the fact that how oral sex and how things can transmit from the mouth to the entire body. Like I didn't get taught that growing up. I didn't get taught that, oh wait, your mouth and then down there things are connected and everything is kind of one and the same. That's what I wish I knew, because I kind of felt stupid. Now everyone around me seemed like some people knew, some people don't. I was like, I'm gonna be a dentist. How did I not know this?
That makes sense. So do you mean like the mouth and the whole body, or the mouth and our reproductive parts?
Both.
The
The mouth and the whole body, and then especially in the sexual content, like the mouth and the reproductive parts, like everything is all one big connection.
Yeah, that's super interesting. And do you remember like a time in your training or practice where you've been like, damn, like that, I wish we'd learned this, or like maybe with a patient and interaction like that?
With a patient specifically comes to mind, which was actually really interesting. I was a student and I was looking at my patient, like doing the regular dental work, cavities, fillings, yada, yada, yada. And then I just saw something in the back of the mouth. I was like, I've not seen this before. This looks different. I didn't know what it was. So I called over a teacher, and I found out then, because it wasn't even taught to us in the books, it was through this experience, that I found out that you can see signs of oral sex in the mouth. So we weren't even explicitly taught this.
Oh my God.
Which was really interesting. And since then, and that's when the conversation started, and then the professor started telling other people, I started telling other students, and it kind of just stemmed from there. So that was really shocking to me.
That's really interesting. And that is one of the questions we also received from our audience today, which was, how can a dentist tell that you've had oral sex?
They can tell. We can get into that later.
What?
Yeah.
Okay.
Mind-blowing, right?
That is mind-blowing. Okay, wait. But let's just start with, like, I guess mouths are such a huge part of sex that I'm really surprised this is the first time I'm sitting down with a dentist to talk about mouths and sex. I guess like we think about our bodies as like separate parts, and then forget that like we actually don't use them in that way, you know, like it's not like there's only mouth activities. Maybe eating is more of a mouth activity, but like sex does involve the mouth in such a big way, and several people do use the mouth like for kissing, for oral sex and all of that, but we only tend to like talk about genitals and stuff like that, right? Like, so why should we also be thinking about oral health when it comes to sexual health?
Yeah, just good. Quick point on what you said. I think a lot of it also is that people think, oh, I'm going to go to the doctor and talk about sex. But at the dentist, they're scared to even bring it up because they don't think that it affects it. So just knowing that it does, dentists can have that conversation with you. You can ask your dentist. You can have that
Really?
conversation. It's still a doctor's office. It's still a curated space to have these conversations. So the door's always open there as well. Dentists want to talk about it more. So if you're concerned about anything, just a quick pitch there, like ask your dentist, talk to them.
Interesting.
Yeah, but the big thing connection-wise, why it's important, anything can transmit from your mouth through your entire body, whether it's cancer, whether it's STDs, STIs, whether it's after eating, after like brushing your teeth, and how timing, how frequency, all of these things make such a big difference, not just for your teeth, but for your tissues in your mouth, your tongue, there's your tonsils, there's your gums. People think mouth is just teeth, but there's so many things part of it. It's one big tube, your throat, where's that going to your stomach? Where's that going down below? Like it's one big tube in your body. It's all connected.
Yeah, but dentists, like traditionally a dentist's job is to look at the teeth or the whole mouth?
The whole mouth. A lot of cancers get first diagnosed from the mouth because traditionally a dentist looks from even outside the mouth, all your nodes here, inside the mouth, basically your whole kind of neck, face region.
Interesting.
So not just your teeth. Yeah.
Oh.
And also, like if you have like bruises or if you have anything like on your cheeks and stuff, dentists are supposed to look at that. They're supposed to analyze that and send you referrals. If they don't know what they're doing in that specific space, they still look at the whole head and neck area.
Yeah, because it is kind of intimate to get in there.
It is intimate, very intimate.
And I think that's why there's also this like general fear of going to the dentist too, right? Like, wow. Okay. So I guess like let's talk about that thing that went viral on Instagram about seeing dentists can see signs that you've had oral sex.
Yes.
Is that true for everyone? Like, how does that work?
Yeah, it's not true for everyone. It went viral. I saw that too, and I was like, oh, this is a fun little thing to go viral. So it's not all the time. So you can't say you give someone a blowjob or you go down on someone. You can't tell every episode, but it's the trauma related to it. So say you're giving someone a blowjob and say if it... physically. So the physical abrasions in your mouth, if you're doing it too hard or with too much pressure, it affects the top roof of your mouth near to your tonsils at the back. There'll be a redder area, there'll be more abrasions there. So if you're doing it very often, yes. Or if you've damaged some of your gums, yes. But like if you've done it once or twice or you did it the night before, then no, we cannot tell. So it's more frequency and intensity.
And is that more when you're going down on like a penis or fingers or like a toy or something?
Yes,
or is it like even for going down on a clitoris or vulva?
Great question. So it's more so with penis, toys, fingers as well. So things that are shaped analogous to that can cause damage. Going down on a vulva or a clitoris, it's not really big enough to go back there, cause these abrasions. So then no, like the juices from that, the liquids, lubricants, they can change your oral health, and we'll get into that piece, I'm sure. But in terms of the abrasive, whether your dentist can tell, no, not with the clitoris or vagina, vulva, nothing like that.
Okay.
Yeah.
So with these other things too, like how do you know that it's just something that happened and like it's going to go away on its own, or I need to see a doctor?
Yeah, follow-up is key. So if you notice it in your mouth yourself, take note, look at it the next day. Maybe after a few days, if it doesn't go away, go get it checked out. To your dentist or to whomever you go to your doctor, whomever you go to, they see it. Initially, if it's not a traditional looking lesion, they won't know what it is, but they'll do a follow with you. Okay, come back a week later. Let's see if it's still there. Let's see if it's grown. Let's see if it's different. And those follow-ups are key. It's not just a one-time take a look and then, because if it doesn't go away or if it needs treatment, if it needs looked into, you have to get it checked out again.
Gotcha. But I would imagine for most people it like goes away on its own.
For most, yes. For abrasions or trauma, things like that, it would go away by itself. It's more the STDs, STIs, or lesions like that wouldn't go away.
Gotcha. And by trauma, we do mean like physical trauma, not mental health
Physical trauma, yes, to
different,
clarify.
Yeah, different terms. One of them is more popular. Yeah, cool. So we've been saying STIs, sexually transmitted infections, a few times. Let's talk about that a little bit more. What can an STI look like in the mouth? And if I like meet someone for the first time, and if it's a hookup or like a one night stand, or I don't even a long term partner, right? Like, what am I looking out for?
So it's interesting because not all STIs are visible. So that's the key piece. So you could say we're sitting here, right? I couldn't tell whether you are carrying something. So say if I did kiss you, for example, I can still be at risk. Hypothetically speaking.
Okay then.
But I could still be at risk. So the key piece is having that conversation. Some STIs, some STDs you can see around the mouth, on the tongue, in the gums. It kind of looks like a pimple, like an acne spot that you have. That's the traditional herpes lesions. It will grow, it kind of look like a cauliflower on your lip, on your tongue, inside of your lip. So those things you could tell all the time because it's visible. But a lot of these things are not visible. Like herpes too, it comes and goes, it waxes and wanes. Gonorrhea you can get in your mouth, chlamydia you can get in your mouth. These things you can't tell. The person themselves may be able to tell because their flavors might be off, they might be tasting things differently, or the scent might be off. You might be able to smell certain things, but the non-visible STIs are still prominent. So conversation is key. Have that conversation. And nowadays, especially like nowadays, people are open of having that conversation as long as you're having it in private. If it's long-term partner, if it's a one-night stand, saying, hey, when's the last time you got checked for STIs? Or do you know whether you're at risk for it? If you're not comfortable having that conversation, say it is a one-night stand, like a hookup, then maybe if you're concerned about it, get a checkup. Go get your labs run. Go to your dentist. Go to your doctor if you're really scared, because obviously you don't want physical trauma to yourself, but you don't want that affecting your mental health either.
Yeah. I have a question. So I know you mentioned herpes, which can be like a little bit of a lesion or something of some sort. How common is it?
Herpes is very, very common. I would say when you're walking around, at least like out of 10 people, probably about 4 or 5 people have it. And it's not. Herpes has a bad stigma, right? Herpes, any STI, any STD has a bad stigma. But it's one of those things that a lot of people have. It's something that you can get treated. It's something you can take care of. Yes, you can transmit it to someone, but it's not going to cause you long-term damage unless you're not going to get treated. So if you do have herpes, just go to your doctor, go to your dentist. They'll prescribe you what you need to, whether it's a topical, whether it's an ingestant, but it's very common. And not just the mouth. If someone has it down in the genital area and you're having oral sex, then that can transmit too. So someone having it on the genitals can transmit to your mouth. So it's not just mouth to mouth or genital to genital. There's cross transmissions as well.
Yeah. I've actually heard even bigger numbers for herpes. I've heard even up to like 80%. And
Can be in some
a
cases.
lot of people like get it and then don't even know they've had it. I think we were talking about this in our episode with Max as well. Yeah, but it's really interesting, I think, to see like how common it is and how much stigma, I think. Stigma is the main point. Are there like risks associated with giving or receiving oral sex that people tend to underestimate?
Yes, for sure. So herpes being so common, you can get herpes with just one occasion. One time you do oral sex with someone, or even regular sex with someone. So STIs and STDs are the biggest risk when it comes to oral health. Oral health and sexual health.
Oh, really? The biggest?
The biggest.
More than cavities?
More than cavities.
Really?
So oral sex will not give you cavities as long as you take care of your oral health overall, which we can get into too.
Okay.
But STIs and STDs are the biggest risk. That's why there's preventative things. You can use condoms, for example. So you can have a condom on during oral sex, which a lot of people are like, wait, no, that's for pregnancy, like pregnancy protection. No, it's also for STI, STD protection. Dental dams. Have you heard of dental dams before?
Yes.
So there's just a little piece of rubber you can put on your vagina. So there's a protection barrier for when
On the vulva though.
On the vulva,
Right,
correct.
yeah.
On the vulva specifically. So there's a protection there. Often a question gets asked though, it doesn't feel the same. I don't enjoy it as much.
We did get one question asking that. Like, what if we give oral sex to someone with a vulva or even to an anus without a dental dam? Like, that was a question. Or like, will it affect how it feels?
It definitely affects how it feels.
Yeah.
It's not skin to skin, right?
Yeah.
It definitely affects how it feels. I still am a proponent of everyone should be using it because it's preventative. However, if you don't want to, then the best thing to do, again, have that conversation. Does that person carry anything? Or even after giving oral sex, then wash your mouth out. I would say don't brush your teeth.
Really? Don't brush after oral sex?
Don't brush after oral sex. Mouthwash is fine, but I would wait 30 minutes before you brush your teeth.
Wait. So,
I know, debunked.
wait. 1 second. So, you're saying like after a blowjob or after going down on someone, there's all these like odors and smells and whatnot because of how genitals can be. we should not brush our teeth.
I know, it's shocking.
But why?
Shocking. So, with your mouth, you have a regular natural pH balance. So, it's acid, alkali. There's this balance that's specific to your mouth. Like in the vagina.
Yeah.
It's the same thing. Fun fact as well, the tissues in the vagina are the same tissues that are in your mouth. The inside of your cheek feels the same as inside of your vagina. That's why a lot of people like when someone gives them a blowjob, because it feels similar to when a penis enters someone's vagina, because the tissues are the same.
I did not know the tissues were the same. Oh my gosh, okay.
But the brushing piece, so why I say wait 30 minutes. So your mouth has a natural balance. So whenever there's any kind of lubricant in your mouth, or whether it's a vaginal discharge in your mouth, or whether it's like semen from a blowjob in your mouth, those carry their own pHs. So that's basically transmitted into your mouth, is affecting the balance that's your body's naturally creating. But that's also now stuck on your teeth. So when you brush your teeth, you're basically brushing it more aggressively, even if you're brushing it softer, because those chemicals are rubbing away the surfaces of your teeth. So you want your mouth to curate the natural balance by itself in the first 30 minutes, and then you can brush. Now you're not damaging your teeth. So in that way, going to the cavities, if you are brushing your teeth right after, because you're rubbing away layers of your teeth, you're more prone to get cavities long term, because your teeth are getting softer over time. But this is over a long, long period of time.
Okay.
So rinse and brush in 30 minutes.
Okay, I think a lot of people do this. It's like I have a date or I have a hookup or I'm meeting my partner and they're coming over and I want to make sure I'm fresh. So I brush my teeth right before sex or making out or whatever. Like, what is your recommendation there?
Right before is completely fine.
Okay.
But right before is just like waking up in the morning, brushing your teeth.
Okay.
Right before is fine. It's right after. But again, like you were mentioning, odors, people want to get rid of these natural odors. Completely fair. So mouthwash. This is where mouthwash is great. So mouthwash is a great protective factor. So quickly give a rinse with mouthwash. I personally would recommend just water first and then wait 30 minutes. But if you want to do something, mouthwash better than brushing.
So if I use mouthwash, then is my risk of STIs gone?
No. Good question, because a lot of people would think that.
Yeah.
No, STIs and STDs, unfortunately, with the way the transmission works, just brushing your teeth, rinsing your mouth, mouthwash, it's not going to remove the risk, because now STIs and STDs are more systemic. What I mean by that is it's in your body. So that's not something you can just wash away. So the risk is there. That's something you would have to get treatment for. Go to your doctor, go to your dentist.
Okay, cool. So I think the other thing is also, like, let's talk about cum, like semen.
Let's talk about cum.
Is this what you wanted to do at Harvard?
This is what I thought I was doing at Harvard.
Okay, cool. So I guess, like, there's this big debate, okay, of like spit versus swallow.
Okay.
And people have a lot of opinions about it from a pleasure point of view, from a like bonding and intimacy point of view. But I want to know what's the dental opinion about this, like from a dentist's point of view.
Yeah, for sure. Spit versus swallow, huge debate. But in the dental community, I don't speak for all dentists, but in the dental community, spit versus swallow is the same thing in terms of oral health.
Okay.
No difference. No difference.
So do what you want to do.
Do what you want to do. Free choice. Do what you want to do. The only thing is, like I said before, it's that the semen is still the same. It's affecting the tissues locally. So spitting versus swallowing, it's still in your mouth. So rinse with water. Wait 30 minutes.
Does it affect the mouth?
It does, because semen has sugars, proteins, glycol in it. So that's not naturally in your mouth. So the sugars are not naturally in your mouth.
Interesting.
But you don't want to brush straight away either.
Yeah, interesting. So are there like any oral conditions that would make it, like you would say, actually avoid oral sex for a little bit?
Yes, quite a few. What's interesting is a lot of people don't know that your risks of transmitting any kind of infection is higher right after a dental cleaning or any dental procedure. So whether you've gotten an extraction, your tooth taken out, whether you've just got a cavity, a filling done, whether you've got a regular cleaning, because there's a dentist been in your mouth doing these procedures, so there's going to be a little bit of a gums bleeding. So now that's an open wound. Yes, you might not be able to see it like a cut or a graze on your hand, but it's still a tiny, tiny open wound. So when you then have oral sex, things are going straight into like the pathway into your blood, into your body. So if you do have an STI or an STD, the transmission rate is going to be a lot higher. So you're more at risk.
So you're more at risk of contracting one.
Contracting one, yes.
Okay. Interesting. Good to know. I feel like that's not the type of thing a dentist warns you against.
No,
typically.
it's not. No, it's not the conversations you have. Can you imagine going to your dentist and your dentist just tells you this? I feel like sometimes the patients have to bring it up if they are concerned about it and curating that space.
I know. I wish we talked about sexual health more in general across the board. Like, I think this is just a problem. That's my personal issue with medicine, that we like only think of one thing at a time instead of thinking of like, how is this going to affect your whole life?
The big picture.
Yeah,
because it does.
the big picture. Exactly. And then like, I guess the other question we have is like, you mentioned this a little bit around like lubricant, right? So like, there's so many lubricants that are flavored. Some of them are a bit sugary, might have glycerin in them. Some of them are sugar-free. Do people with cavities need to worry about lubricants?
Not just people with cavities need to worry about lubricants. Everyone does. Whether you've already had cavities or whether you've never had one, you can always get cavities. No one's ever immune to cavities. So the lubricants that would be recommended for everyone are the sugar-free options.
Okay.
Think of lubricants as if you're picking out a piece of gum. The more sugary the gum is, the worse for your teeth. Same thing with the lubricants. The more sticky it is, the more flavorful it is, the more sugary it is. All these things are bad for your mouth. I'm not saying don't use them, because they are fun. They are fun, enjoyable. Some people need them. Some people just like to use them. But again, once using them, rinse your mouth out right after. With water or with mouthwash, just make that balance back to what it used to be. Then you're fine. So it's more duration, not frequency, which is also the key part.
Gotcha.
So if it's constantly in your mouth for 10 minutes versus just you've had oral sex and now you washed it out a couple of minutes later, that's better than it just sitting in your mouth for a long time. So shorter periods of time, fine. Rinse your mouth out.
I'd imagine it's kind of awkward to like get up midway and then like go
It
rinse
is
your mouth.
It is awkward, but just then do it at the end. You don't have to do it at the end.
Okay. I can get behind that. Is there a brand or type of lubricant that 99% dentists recommend? or just you?
I see what you did there.
or just you.
Brand? No, I just recommend that, like I said, the sugar-free.
Sugar-free.
They do.
Okay.
They don't have them right at the front of the package, but you can read the ingredients. Xylose is great option as well. So xylose is the substitute of sugar, so it tastes sweet still. They can have the flavors, but it's better for your mouth because it's technically less sugary. So xylose is a great ingredient.
And I guess like to this point around pH balance and all of that, I think I always try and remind people that the vagina is like really, really sensitive to any type of flavoring. So even with sugar-free stuff, sometimes people, definitely with sugary stuff, but even with sugar-free stuff, it can like be a little bit disruptive and cause infections because of how it disrupts the pH or invite like a yeast infection or whatever.
Same thing with the mouth. Same thing with the mouth. If you've got a tooth pulled, now you want to wait until that site is completely healed before you engage in oral sex, because it's a wound. Just like anything on top of it is going to create a higher risk for infection.
And I guess also same thing for the anus.
Same thing for the anus.
Same thing for the anus. So flavored lubes also in the anus, people tend to be a little bit wary of. I guess like this is, since we're talking about lubricant, like talking about making things wetter and slipperier and slidier, saliva is such a big part of this experience of oral sex, especially especially when you're doing like anything that's like a penis or fingers or something like that. There are certain medications, or even just people have this, sometimes are more predisposed to having a dry mouth. Are there like any crossover tips for like dry mouth and oral sex?
That's a great question. So dry mouth, the fancy term we call it is xerostomia. Your dentists do talk about it often because dry mouth does increase your risk for cavities. So it is something a lot of dentists see, saying you have dry mouth. You can get prescription, like medication for it. Prescription medication, they're pills you can take. There are also rinses you can take, rinses you can use, and it promotes your salivary glands from like squeezing out more. A big thing as well, if you really do have an issue with this dry mouth and you find yourself using more lubricants because you're naturally dry, so you're not partaking in oral sex when you want to be, ask your dentist, because you might have a salivary issue, and there's a test. They will do a saliva test to see, is your salivary flow normal? Is it low? And then they can prescribe you things according to your salivary flow rate. They cannot increase it. There's no fix, but they can help you.
And I can imagine like that's a conversation you can have with your dentist without mentioning oral sex too.
1000%.
Right.
You can say, hey, I'm having dry mouth. You can, if you're embarrassed by it, you shouldn't be, but if you are, you can talk about food. Okay, some things are like, it's harder for me to like chew foods because there's less saliva, or I just feel dry throughout the day. I find myself drinking a lot more water. You can frame the question any way you want, and they'll be happy to talk about it.
Good to know, because that was my other question. Like, how do I know that my mouth is a normal amount of dry versus like I need to see a doctor amount of dry?
Yeah, if you're like, for example, we're talking right now. If you feel the need that, oh, it's been about 5 minutes of talking, I really need water every couple of sentences. Which is fine.
Yeah.
But say every question you're asking me, if you feel the need to drink water so often, not because you're thirsty, but because you feel like your lips are sticking together so much, I would bring that conversation up with your dentist, because then that's not very normal.
Okay.
Yeah.
Good to know. And then like I want to explore more this point you brought up about like how oral sex affects the entire body. And as I was researching a little bit for this episode, I also saw that there were some specific risk factors around like how oral sex can affect people with uteruses during pregnancy and maybe even semen and quality and stuff. Yeah, so just like what are some of the risks for the full body?
Yeah, for the full body. So it all comes back to STIs and STDs. And a lot of them are not visible. Say, for example, you can get chlamydia in the mouth, or you can get it in the genital area. Sometimes you don't know you have it. That it might be low threshold, not very many symptoms. You're pregnant. This can be transmitted to your fetus, to your baby. Your baby can have eye issues. They can have hearing issues if you're carrying these STIs, STDs, and they can be transmitted through your mouth.
If untreated.
If untreated.
Right.
That's a key part, yes. In terms of semen quality, again, if untreated, it can affect your sperm count. It can affect your...
Wait, so it's the STIs?
It's the STIs.
I see.
Yes,
Okay,
it's the STIs
gotcha.
specifically, untreated. Where in terms of just regular day in, day out having sex, or frequency having sex, no. Does that affect your pregnancy? Does it affect your semen count, semen flow? No, it should not.
Okay, good to know.
Yeah.
And then the other thing, which I feel like especially here in the US is so important to talk about, is like dental health is not a given. It's not always covered in insurance, and some people might have a hard time going to dentists and doing oral procedures and stuff. So this is not exactly a sexual health question, but just like a general oral health question. What are some of your top tips if someone is unable to go to a dentist regularly?
Yeah, so try preventing getting cavities, because cavities are never fixable unless you do a procedure. You cannot reverse a cavity. You have to go to a dentist and get it fixed. So prevention is key. So if you're drinking just beverages, instead of sipping on them, use a straw, because then it's not touching your teeth as much. Or if you're drinking a can of Coke, it's not good for your body, but how I say it as a dentist is you can drink 10 cans of Coke in one sitting. That's better for you than drinking one can over the whole day. Because 10 cans, you drink it, now fine, you're done, your mouth naturalizes again.
10 cans of Coke.
Theoretically speaking.
Gotcha.
Instead of sipping throughout the day. Or in your coffee. People sip on coffee while they're working on their desk all day. So bad. Drink your coffee, then sip on water. Sip on sugar-free things that don't have that many, like things that are not going to affect your oral health that way. Other ways, if you do find yourself like you have a little bit of a swelling or something like that, that's something that you can go to emergency departments and get treated, because swellings can then transmit to your neck and it can become even bigger, which you don't want to do. So swellings are something you should look out for. If you have any swellings or bumps in your mouth, then go to the emergency room if you don't have dental care, but that's a key piece.
Gotcha. Thank you so much.
Of
and
course.
now we're gonna do a rapid fire round. Are you ready?
I'm ready.
Okay, so in this round, I'm gonna ask you questions where you have to give me a brief, quick answer.
Okay.
And
Can I do brief? We'll see.
it's gonna be quick.
Okay, I'm ready.
Cool. If you use condoms for oral sex, you don't have to worry about any dental risks. True or false?
False.
Why?
Because STIs can be transmitted through, it just lowers the frequency of risk.
I see. Okay. If you can see HPV in the mouth. True or false?
Not always.
Okay.
Yes, you can, but sometimes it's visible, sometimes it's not visible.
Even a doctor can't?
Even a doctor, because it waxes and wanes. Like 1 month I might have a presentation, and then the next month it will go away, but then it'll come back again. So it goes up, ebbs and flows.
Is that true for both herpes and HPV?
It can be. It's true for herpes, and it can be for depending on the strain of HPV.
Oh, interesting. Okay, cool. If I have the HPV vaccine, I don't have to worry about HPV, true or false?
False. There's still signs, yes. It will decrease your risks tremendously, but false. It's not a complete cure.
Gotcha. If someone has gum disease, they should avoid giving oral sex, true or false?
True, because again, it all comes back to the STIs and STs. It increases the risk of getting an STI because you have open wounds in your mouth. Can you do it? Yes, but it does increase the risk.
Okay. Electric toothbrush as a vibrator.
No.
Yay or nay?
Nay.
Why?
Nay. Clarification question. Are you using the same electric brush to brush your teeth?
No. You're just using like the vibrating parts.
No, because they're harder to clean. And whenever you use toys, you should be cleaning them afterwards just for regular sexual health.
Yeah.
So they're harder to clean.
But if you put a condom on it?
If you put a condom on it, it's better.
Okay.
It is better.
Okay.
So I guess sure. Like
Yeah.
if you're putting a condom on, it's smoothing out the surfaces and then it's staying clean. Sure. Yes.
Okay, cool. But be careful with sharp objects, especially for internal use. What is one thing you wish every sexually active person knows about their mouth?
A rapid fire question.
She forgot.
Just because you can't see it doesn't mean you can't spread it.
Okay, that's a good one. And what is one resource or sexual health source of information that you rely on?
The dentist. Ask your dentist. Talk to your dentist.
That you rely on.
That I rely on. That I rely on. Your podcast. Honestly, just talking to people, talking to experts in the field, even talking to your friends. Your friends know so much things that you might not know, or they might be even scared to ask you questions. Just having open conversations. So I rely on the conversations.
I love that. I really love that. All right. Thank you so much, Shyrie, for being here today.
Thank you for having me. This was fun.
This was so fun. I learned so much about dental health and oral health and oral sex and dental oral sex health.
I learned stuff too.
This was really fun. Everyone who's watching, thank you so much for watching. Please don't forget to like, comment, subscribe, share, do all the things, press all the buttons, and tune in next time. Bye-bye.
Bye.
When it comes to this intersection of sexuality, psychiatry, we often think about like side effects.
So when we talk about sexual side effects, that's something bad that happened because of the medicine. So as doctors, we try to help you with that.